Hello, everybody. My name is Karen Bopp, and I'm one of the co-chairs, along with Rebecca Kinzinger, for the Autism Alliance of Canada. Thank you so much, Minister Holland, for your words. Yeah, we understand. We really appreciate you coming, and we will move forward. We will move forward with every step forward is progress. So thank you. So we are going to move on to our first panel. So I'd like to start with its Harmonizing Hope, Bridging the Gap Between National and Local Autism Policy. So I'd like to invite up on the stage Sally Scott, who's the Executive Director in the Division of Children and Youth for the Public Health Agency of Canada, who really is, and Sally and her team are spearheading and really working hard every day to help create a national autism strategy and framework that's going to work for all autistics in Canada. And Susie Dubois, who is the autism coordinator and project lead. Where are you, Susie? Oh, she's coming. Yeah, come on up to stage for the Department of Education in Early Years for PEI. And Marg Spolstra, where are you, Marg? You are here too. There she is. Who's the Chief Executive Officer for Autism Ontario. So come on up and we'll start our panel. So we'll go through, I'll ask a few questions to each of the panelists, and after that we'll have an opportunity to sum up and for questions from the audience if needed. So thank you. Everyone's, oh, they work. This is great. Oh, okay. Are we ready for the slides? Oh, there's no slides up yet. No, okay. Thank you. So, thank you all for coming today, and I'm going to start with Sally. And again, we're so grateful for the work that the Public Health Agency of Canada is doing towards creating a framework and a national autism strategy that we want to get right, that we want to ensure, as Minister Holland said, lays the foundation for ongoing progress. So thank you. So we do have a slide for you. I don't see it up, but they'll sort it out. Thank you. So Sally, I'd like you to start us off by telling us about the federal mechanisms that we can leverage to develop and action an effective national autism strategy. And some people may not know what these sort of mechanisms are from the federal government. So tell us a little bit about the Interdepartmental Steering Committee, for example, or the federal, provincial, territory working groups. How can we leverage these to move forward and progress with a national autism strategy? Terrific. And your slide is up.
Oh, it's up there. Terrific. Thanks so much. Thanks so much. And I guess I have the challenging task of being first up after my minister, who did an amazing job, I think, at capturing the frustration, the hope, the desire for change. And if I think of just how we started, and I think Rebecca mentioned the themes for the conference, which are really inform, implement, and innovate. I think we heard all of those things from Minister Holland. And so I'm pleased to be able to be here to provide a bit of additional information on what we see as our federal role in helping to drive that change. And respond to your questions, Karen, I will. Just from an accessibility perspective, for those, I will describe myself as a white woman with shoulder-length gray hair and a black suit with a white shirt. And I guess I would say I'm sort of a plus 50 person as well, if that gives anybody an indication. But I'm really happy to be here today. So. On the screen, you're going to see there's a map of Canada, and I thought we would try and keep it very simple. And In addition to the map, I've outlined 5 areas that I just want to touch on from a federal perspective. And why the map? And I guess as a starting point, it really is to emphasize regional diversity. So when we're approaching the development of an autism framework or an autism strategy, we have to look at the diversity of the country. And part of that diversity is what is one of Canada's great strengths, and our ability to work with individual provinces and territories and really allow them to make sure that the supports and services that are provided are tailored to those jurisdictional realities. And at that provincial level, then there's even further diversity at a local level and then at a community level. So making sure we have a framework that is reflective of that diversity is really important. And then the federal roles and responsibilities in a federated system, and Minister Holland spoke to these and said it's always very unsatisfying to say, well, that's not my jurisdiction, that's your jurisdiction, we can't help you. You know, federal roles and responsibilities for healthcare are shared with the provinces and territories. The federal government provides those high-level health and social transfers to provinces and territories, while the provinces and territories have control over how health, education, social supports and services are delivered. And as we know, provinces to differing degrees provide a range of autism supports and services, and then in the territories, it's not autism specific per se, but as part of broader disability services. So there are many stakeholders that we have to consider as we move forward with a framework and strategy, and all of those players have a significant role in improving the availability of supports and services for autistic Canadians, families, caregivers. So what are the federal government's responsibilities for autism? So we have public health surveillance, which you'll know, data collection, knowledge translation, trying to get the information that's available, the evidence to support informed policy and program development. We also have responsibility for developing and implementing national policies. And so a federal framework on autism and Canada's autism strategy would be 2 of those key national policies. We have a role to play in increasing understanding, inclusion, and acceptance. We fund community-based programs, and those of you who are familiar with the Autism Spectrum Disorder Strategic Fund, through that programming we did fund a number of community-level investments to help drive change in specific areas. We have a role to convene partners and stakeholders, and I'll speak a bit more about that convening role. We support ongoing research through the Canadian Institutes of Health Research and through other mechanisms. We administer financial supports, as you'll see through the Canada Disability Benefit and other tax measures. And we engage and collaborate with stakeholders to advance opportunities and best practices. And we've done that through a National Autism Conference that we held in November of 2022 by participating today in these types of events to hear from people with lived and living experience, and just to through our ongoing engagement. And so in that way, we're hoping that these things you'll see reflected in the federal framework and an autism strategy. So what is the convener role? And we'll often say, you know, this is an area of provincial or territorial jurisdiction, but we have our convener role. And folks may be thinking, well, what is the convener role and why does it matter? And so really for us, it really is using that role to obtain higher level buy-in at a provincial level, a territorial level with stakeholders, and as well to see how we can leverage that intellectual and financial support that we need to advance key priorities for autism. And we also need to reflect the voices of autistic Canadians, families, and caregivers, health system experts, clinicians, and others. And that's another way that we play that convener role, is by making sure that all those voices are heard to inform policy and program development. And so bringing people together, funding initiatives to bring people together, clarifying our vision and our purpose through a framework and strategy, and setting out key milestones for what we hope to achieve over, for us, the next 5 years if we're thinking in terms of the autism strategy, and that's speaking a bit to the incrementalism that Minister Holland spoke about. Let's be bold and ambitious, but let's proceed through radical incrementalism. I thought that was a really great way of describing it. So we would see having an implementation plan to support the strategy and the framework that does include clear measures for accountability that would be set out in a corresponding evaluation plan that would include benchmarks and indicators so we can measure our progress over time. So in that way, our convener role is going to enable us to set out this broad policy direction, to bring the right people to the table, to have the experience and expertise to inform the development of an implementation plan, and then to help us implement and to keep us on track to measure our progress in implementing. And so how are we going to do that? Going down to another level, the governance system. So we have a federal, provincial, territorial working group, and Susie is on our working group, so we have a chance to work together. And this group was established in 2022, so several years ago, and it's going to evolve. We would see that federal, provincial, territorial working group evolve then to cover implementation once we have a framework and a strategy that have been released. And that FedProv working group can also look at opportunities for innovative projects. How can we look at innovative projects that could be tested in different jurisdictions and then scaled and spread? We can also look at opportunities to develop national guidelines, and one of the areas that does come up is adult screening and diagnosis, other areas for guidelines in terms of health workforce. So we received a lot of great recommendations through the report from the Canadian Academy of Health Sciences, which will be reflected in a framework and a strategy, and it outlined a lot of opportunities that can be pursued in the area of national guidelines. So once the framework and strategy are released, we'll have the ability to move forward and work collaboratively with provinces and territories in that area. Interdepartmental Steering Committee. So in addition to the work that provinces and territories are doing and the work we can do together, other federal colleagues, Employment and Social Development Canada has responsibility for the Disability Inclusion Action Plan. How can we leverage that action plan to make sure the voices of autistic individuals, families, caregivers are reflected in that through things like the Canada Disability Benefit, through other housing initiatives that are run through the Canadian Mortgage and Housing Corporation. So we have an interdepartmental steering committee that allows us to have these conversations and to identify how we can leverage those opportunities and grow them. And then in addition to that, we see creating a national autism network, and that would be a way to establish a mechanism to bring together on an ongoing basis the voices of autistic individuals, families, caregivers, clinicians, health system experts, et cetera, to be able to inform all of the work that we're doing at a provincial and territorial level and across federal departments. So priority areas, and the minister mentioned the priority areas that we're going to work on, and he touched on them, and I'll reference them. I know they were discussed, I think, at the conference last year. They were shared with everyone. They're truly reflective of what we heard through our extensive engagement, the engagement that was undertaken by the Canadian Academy of Health Sciences and that we've undertaken as well. But screening, diagnosis, and services, the first priority area. We've heard about the need to do something, to do more here. We've heard about health system challenges. I think if the minister's speaking about things that cause frustration and that could be broken, health system challenges are the ones that come up first and foremost. Financial support, a second priority area. We've heard about the need to make sure that autistic individuals and their families and caregivers are equipped and have the financial support that's needed. The third priority area, data collection, public health surveillance and research. And we all know that that evidence, that information is really key to informing all of the work that we do. And the minister talked about data interoperability and the priorities that are associated there. The fourth pillar, public awareness, understanding, acceptance, the need for targeted acceptance campaigns. We've heard about the fact that more needs to be done there to support autistic Canadians at every stage across the life course. And then the fifth priority area, which is the tools and resources, to make sure that the tools and resources are available and that there are navigation supports available to help autistic individuals and families. So these are the priorities that you'll see reflected in a framework and strategy that reflect what we heard from the autism community. And then effective implementation will require the diverse expertise and perspectives that we've talked about. I touched briefly on the idea of the National Autism Network, which we see as a key piece that will support implementation in addition to all of our governance mechanisms, having a permanent mechanism that can bring the voices of autistic individuals forward and that can undertake work in specific priority areas is going to be key. So one of the first steps that we would see a network doing would be to create those advisory committees to then provide advice to us on implementation. So just to conclude, I think I might have gone a bit over my time there, but involving experts and people with lived experience, fostering that collaboration between different levels of government, different federal departments. I think we have in place a really strong mechanism that we're starting from, and we want to grow and build that further through the spirit of radical incrementalism that the minister spoke about. Thank you.
Thank you so much. I think it is so important that I really appreciate you are talking about sort of that intersectoral, the cross-ministry, what we find is that we want to make sure the National Autism Strategy touches every part of an individual's life and it is supported throughout there. So that's great to hear. Susie, so how do you see a National Autism Strategy or a National Autism Framework fitting into a provincial infrastructure? So maybe you can sort of comment on, Minister Holland, talked about it, then and Sally, went through the actual role of the federal government with the provincial governments. How do you see that sort of fitting in, and how can we bring a NAS to life at the provincial level, on the ground level, and how does it really fit, and how can you see it make it work? And so I know you have some great examples from PEI, and so we thought that maybe you can share some thoughts.
I'd love to, and I'm so happy to be here with you, to learn with you and from you, and so happy to meet my fellow colleagues up here in person finally. Thanks for the question, Karen. And I'm happy to bring the PEI perspective. And I say that with a touch of irony because I know that PEI is the smallest jurisdiction in this country. I also know it's one of the smallest populations. But I also think sometimes it gives us an opportunity to pivot or be a little bit more nimble in policy making or program implementation because of our size. And because of our ability to maybe bring ministers or departments together, because realistically they're within a couple of blocks of each other. True, true story. So especially with the bringing in of the National Autism Strategy and how we look at about that partnership with the federal partners and provincial and territorial partners and how important it is. What we hear time and time again is that need for coordination, that need for that open communication. And when I say communication, I mean it's running both ways, not top down. And for me, the essence of coordination of services and collaborative services is communication. So when I hear about the launch of a National Autism Strategy, from a policy maker perspective, I think, well, how does that work on the ground? How does that work in a practical aspect from a provincial government perspective? How do we take a national framework and how do we make it work? How do we connect the people that need to access the information? And how do we make sure that it's not a duplication of services? And how do we think, okay, well, those recommendations, what do we have that's working on PEI, and what can we learn from the framework, and who can we bring together to make that happen? So with a little side, or an aside as a backdrop, is something that I think is unique to PEI is that we have a piece of legislation called the Autism Coordination Act. And it's a relatively new piece of legislation. It's about 5 years old. And in government terms, that's pretty new. And what it is in a nutshell, and I have to say that this piece of legislature, which was passed unanimously in the provincial legislature, is a direct result of the strong advocacy and dedication of a group of autistic islanders, their caregivers and families, and community service providers. They fought for this, and it was supported within the legislature unanimously. And what this act says is, hey, like, we all need to be communicating, we all need to coordinate. We can't have these silos. We can't have services and programs that are developed and delivered in a particular department, not talking to another department next door, because we all know that services and programs have great implications. Something that happens at one age group or in one department is going to have an effect, an impact on other department services or community partners. So the Act basically says we need a mechanism for all the partners to talk. That is, having government departments speaking to each other and within departments. We need a channel of communication for our community service providers to be able to access and access to information and to communicate with our government decision makers. And most importantly, we need consultation with autistic islanders to be meaningful and frequent. And there aren't specifics in the Autism Coordination Act, but it's quite broad in those milestones. So what does that look like, and how does that impact a national autism strategy? Well, what that is, and you're seeing the chart on the left here, which shows an organizational structure of the Autism Coordination Act. So how does it work? It means that there are a group of deputy ministers from our provincial government representing each of the departments where autism-related services are delivered. And they meet monthly. And those are the individuals that I report to, that I work for. It is the Deputy Minister of Health and Wellness, the Assistant Deputy Minister of Health and Wellness, the Deputy Minister of Justice and Public Safety, the Deputy Minister of Education and Early Years, I'm forgetting one, Deputy Minister of Social Development and Seniors, and the Secretary to Treasury Board. That is our Provincial Autism Coordinating Committee. And every month, these Deputy Ministers meet, and they get briefed, or they have information sharing, or they share about programs and services that are being worked on or addressed or needing to launch in their particular departments. And they talk about the impact that these different services could have on the other government departments. And that community service providers and our partners in delivering services and supports, that they are engaged, that they have this opportunity to share their feedback of where the needs are, or the gaps in services, or funding requirements. This is another avenue of communication for those partners. It is also another avenue of communication for autistic islanders and their families and caregivers. This is what we are experiencing. And it is a formalized structure of how this information experiences can be shared and discussed and debated, and also helps to identify priority items. It also is a direct way to combat the silos that exist across services. So I know that that's rare to have a group of deputy ministers meeting monthly and specifically to coordinate autism services. Again, I recognize that that's because we have deputy ministers within a couple of blocks of each other, and we can do that. But I think there is a learning from that, about that bringing together and talking about, of looking at it in terms of we're in this together, and let's all work together, and that it is an information sharing. The organizational structural chart that is in front of you, it is simplified. It implies that sort of communication is going one way, or top down from the deputy ministers to that. That is not the case. It is a back and forth of communication. It is also not to say that there are already pathways of communication that already exist. So if there are community organizations that deal with funding with a particular department, they still have that relationship. This is another mechanism to make sure that priority items are addressed. So as it comes back, pardon my tangent, Karen, but back to your loop of how this looks like from a federal perspective is, as the National Autism Strategy is released, we have the opportunity on PEI to take that information and have the departmental decision makers around the table at the same time to make sure that the information is shared to the pertinent departments at the same time. When we talk about how we can implement some of the recommendations that are in the strategies or in the framework, it's okay, well, we can do this, but what is the impact on your department? What is the impact on your clients and service and clients or autistic islanders? And let's talk about this together. And that, I think, is going to be really powerful when the framework and the strategy are released. So I'm excited to see this format of the Act really being put to the test in action in the coming months.
Thank you, Susie. It's such an interesting model, and I think there's other provinces and territories who are here today and going back to our own provinces and territories. And, you know, yes, you're a small province. Yes, you have a small population. Yes, people live close to each other. But being further away from each other, a larger population, is not an excuse not to do something like that. To gather the deputy ministers together across the different ministries and departments and to take a national strategy that is affecting every part of an individual's life. And I love the idea of just having that communication there to everybody all at once. You have the infrastructure already to take a national, whatever comes with the National Autism Strategy, you're not sort of scrambling of, oh, how are we going to now implement this in our own province? How are we going to let everybody know about it? You have it already. So I think as, I encourage other folks to go back to their own provinces and territories and sort of what is our structure so that we're ready for when the national strategy and the framework is announced. Are we ready for it? Are we ready to take action? Because as the minister said, we need action now, sooner than later. We don't need to wait another, how many years? I know that Senator Munson is here, and this all started with pay now or pay later, and that's so long. That's years and years. And I don't know the date, but you can tell me. And we need things to happen now, and it seems like you're sort of ready for it. So how can we get our provinces to do that?
We hope so. And I'm proud of the work that's being done to build and rebuild relationships, especially with Autistic Islanders and community organizations that have been carrying the heaviest of loads.
Yes.
And if this is one more avenue where meaningful consultation and their voices and the autistic experience can be better heard, because it needs to be at the table when decisions are being made, and that's what I'm proud of. And I'm hopeful that it will be really helpful when the implementation of the NAS comes out.
Wonderful, thank you.
Thank you.
So Mark, let's move over to Ontario. We'll kind of go a little bit west, sorry. It's very tired. I'm from the west, so it's still very early in the morning. I'm just gonna tell you people. Everybody's like, starting at 8. Okay, that's 5 in the morning for me. Whew. So, what has been your experience in Ontario, and what are the points of adjustment do you see need to happen in Ontario or in a larger province to create an infrastructure where a NAS can be delivered where it makes a difference?
Thanks, Karen. It's so great to be here and to see so many friends, colleagues, people who have been around for a long time trying to move things incrementally forward. I love that term, and I hope it gets used and that we can talk less about incremental, but really seizing the day and making things move in a direction that makes sense for Canada. I think the slides, I'm not going to go through these because I'm sure when you saw that you went, oh dear, she's not going to go through that whole slide in detail. But mostly I wanted to talk about just the way autism funding works, and that really is through individual ministries and specific programs. But there's duplication in some places. There are key programs that happen, and I highlighted the Ontario Autism Program because the Ministry of Children, Community and Social Services is really the key funder of programs in childhood years. And so we see there are pieces of good work happening, but it's not well coordinated. So when I hear a story about, well, just go next door and make that happen, that makes my heart sing to think we could make that happen. And indeed, I think that is absolutely necessary. And in Ontario, when ministries have worked together, we see greater longevity in those programs and approaches because it has impact. And at the end of the day, that's really where we need to be. I would say there have been some changes with the Ontario Autism Program. For those of you who follow what happens in Ontario, this has been a long time coming and rolling out with many iterations across various governments in Ontario and trying to get it right and not always getting there. But we're seeing some progress. We're seeing some very encouraging opportunities for families taking place, and you can see those on the screen for yourself, and I'd be happy to speak with you about that in more detail. We also have, I'm delighted that we've got members of Autism Ontario's Board of Directors are here today. Many colleagues that we've worked with through Access OAP are here at the back table there. And others we've collaborated on with Nova Scotia on various programs when things work in our provinces and we share that information. So I'd like to say that I see when we talk with each other and take good ideas and then try to find ways to adapt them in our own communities is really important rather than trying to roll out a single one-size-fits-all approach. So if we could go to the next slide so that I stick with my time limit here. There we go. I just want to speak to some of these. And I think for Ontario and for all of us, if we think on a national scale, all of us have bits of information and data. We need to bring this together in a way that no one has any question about who has autism, where they live, who are the people supporting them, and how do we know when something is making a difference. And if we can start to have that message that says, in Canada, this is the story. These are the things that we're seeing make a difference and have a greater impact, and here is the data that tells us that. And I can know for sure that no matter where I live as a Canadian, I can gain access to those services and supports. I also think that we need to think beyond autism and thinking about neurodevelopmental differences, and thinking about what does that look like when we work together. And indeed in Ontario, in the research area, the Province of Ontario Neurodevelopmental Disorders Network has been doing exactly that, thinking beyond just one picture and looking at what do we have in common and where do we see programs that benefit all of those stories, because that's good news for autism too. So I think those are some key pieces. So let's get that information, a clearinghouse, and that also is very translatable. So we can say, if we have this many people in this situation living with this kind of opportunity or challenge, we know what those numbers are, and we know who those folks are, what age they are, where the pressure points are, and that we can, any one of us could speak to this easily in our provinces and say, this is why the funding makes sense for this. And that we bring that together. And does it mean we should collaborate across provinces? Yes, sometimes, but other times maybe not. And so I think at a federal level, if we can start to say together what the information looks like, and that we don't just have little bits of siloed information that doesn't get translated to actual change and impact in people's lives. and that needs to be across the life course. So on my slides, also the second point I want to talk to is briefly about early years. We need supports across the life course, but we need to get our young kids and their supporters, their families, having access to good information and what that child needs to grow and learn early. We know about that. There shouldn't be any place where you have to wait as a child to gain access to this in Canada. And so some of that is happening in different places in the country. Ontario's not quite there yet. There are steps in that direction, but we need to make sure that those kids get off on the right start, on the right foot, and their families are supported through that process. So early matters. The third point I want to talk about is mental health supports, and I think that is something that we can really think about on a national scale, because there is a lot of good work that has happened in this area. We need more people who do this work. And we can't rely on only regulated health professionals to do the work. We need that, we need those folks, but we also need a larger team of people who have skills and understanding in this area. And so we did a project in Ontario with CMHO in training 5,000 people on what it means to understand mental health and autism. I think those are kinds of programs that can be grown, and finding new ways to make that information be much more accessible, and that there are multiple layers that move back and forth depending on the needs that change over the life course of an autistic person's living. I want to just thank the Public Health Agency of Canada, and thank you for your comments about some of the funding that we were able to receive within the province and territories. Those were really instrumental grants. The fear I often have is those are short-lived, and we need something that is sustainable, because we scramble and compete with one another for those funds. And so if we can get funding that becomes a stable source towards really clear outcomes and goals that are based on the aforementioned information that we should be talking about very specifically. And then just briefly, schools, right now I know when I speak with my territorial and provincial colleagues, everyone is having a heavy heart about our education system and seeing some of the challenges that are there. Kids being sent home early, teachers simply not coming to school and being asked to keep their kids home, not having a sufficient number of trained people. We need to work together with our ministries that allow regulated health professionals to come into schools and work as a team with the kid as the focus, the student. Those needs have to be above and beyond what it means to work collaboratively with professionals. Where is the need for this child to learn and grow where they spend most of their time in a school setting? Okay. And finally, the transition to adult years. We really don't have good programs in Ontario right now that facilitate that transition. There are ways to do this, and I think this is where we need that clearinghouse of information to say this is the program that is making this difference to help people grow and thrive in their adult years. We have all talked, every one of us has had a slide in our presentations in our careers here about going off the cliff in adult years, but it's still true and it shouldn't be. We have folks who have so much to contribute, both in employment, in expressing who they are, in being members of their community and fellow citizens, and we're losing those opportunities. So we do need to get these points across the life course. We need to work together. There needs to be clear objectives and goals with dollars that get attached to moving the bar of that positive impact. And we need to work across neurodevelopmental differences. And I'll stop there.
Great, thank you so much. You know, as you speak, I'm sort of trying to draw this line from the federal to the provinces as well, and I'm starting to think about what's our call to action after this panel. Sort of what do we want to take back to our provinces and territories so that we're ready to action these pillars, so that as we look through the pillars. And what I'm hearing from everybody is, you know, communication. You know, let's make sure that the pillars and the strategy and when it is announced, that information gets to the right people at the same time and is informed by autistics within that province as well and their families. And, you know, and so I just wanted, I'm going to put you all on the spot. What is sort of your call to action for folks today after thinking about this? What should people go home and advocate for in their province or territory so that we're ready? Because we all play a part. This isn't just a federal initiative. This is the provincial and territories, and we all play a part. So what part can we all advocate for and play? So does anybody want to start of your call to action? I mean, what do you want to see from provinces and territories so that they're ready? What would you like to do? Yeah. Yeah.
I'll go first. From my perspective, sort of touching on what Sally spoke and Mark, is one, as you said, Mark, there's so much knowledge out there. There's so much awareness and knowledge that we don't need to keep reinventing the wheel.
Yeah.
And so when we get to the point of an implementation stage and taking the information, you know, PEI has a system in place to get the information out. Can it be improved? 100%. Can it be done more effectively and engage more stakeholders and do more meaningful consultation? 100%. So the meaningful consultation piece obviously is a call to action. But it's also about reaching out beyond your jurisdiction and saying, what's happening that's working really well in your jurisdiction? And it doesn't necessarily need to be copied or have to be copied, but there's so much knowledge out there. Let's learn from each other. And there's a great opportunity in the coming months to start those conversations so that when the strategy is released, it's like, oh, okay, well, why don't I reach out to a Susie in PEI and how did they do that? Why don't we reach out to a Marg? And, you know, because Ontario's ahead of PEI in a number of things. So making those connections now so that when it is released, then can be boots on the ground and action happening sooner rather than later.
So even a call to action right now is doing our networking, introducing yourselves, connecting with other provinces and territories, and, you know, exchanging those numbers and emails and getting things started and so learning so much from each other. Yeah.
And not even in my jurisdiction, it's like on PEI, I know where the gaps are. But if I connected with different organizations and individuals from different provinces, what's going well in your area? What can I learn from you? Which is, I know I can learn a ton, of what's going well, what's working. You've been there, done that, you know, decades, maybe longer than maybe PEI has. Okay, so what can you teach us? What are you willing to share with me to help services, supports, and autistic islanders and their families on PEI?
Great.
Yeah.
Sure. Maybe I'll jump in, and I guess for us, really, we want to get the framework and the strategy released so that we can move into the implementation phase. And really, for us, the implementation is where all of these conversations that Susie's referenced are really going to start to happen, and in a way that is going to include the voices of autistic individuals, families, and caregivers directly in that process. Right now, we've had a variety of different types of engagement going forward. We really see once we get to implementation, and I mentioned the National Autism Network and the advisory committees that would be set up through that process will bring that input and those voices directly into the existing governance mechanisms that we have. Susie and I already participate on a FedProv committee. We're already sharing this information, and we're having these cross-jurisdictional conversations. We want to bring more people to the table. Provinces and territories want the ability to do what PEI has done and go back and actually include more folks from across education and social services and justice. And so having a framework and a strategy that they can take back into their jurisdictions and say, look, these are the priorities we need to work on collaboratively together, will bump it beyond where it is right now, which is in the health sphere, because, you know, public health reports to the Minister of Health, and we have the Conference of Deputy Ministers of Health, which the Minister spoke to. we need to include more people. And so having a framework and strategy released provides that roadmap that we can take forward and then start to have those conversations around implementation and involve the right people in designing the implementation and setting our milestones and our benchmarks and our indicators for what can we realistically achieve within the first 5 years to move things forward. We want to get to action, and to do that, it's like we need our high-level guiding principles, roadmap, and strategies released to rally people around and bring the voices to the table. So I keep saying the same thing over and over, but how do we get to implementation is sort of our...
possible. Yeah. Mark, did you?
Yeah, I don't have a lot more to say because I think you've been very articulate in voicing what those key issues are. I'll just add to that again in terms of the voices being heard. We really need to be thinking about ways to get to the voices that don't get heard. And I think that's not so easy, and that means being a little bit uncomfortable at times to say we can't say this speaks for the autism community or this information if it doesn't actually do that. And I think there needs to be greater transparency about what's happening in our provinces and territories, and that data become available not only to us as the autism community, but in places where it impacts lots of other aspects of daily life. So I do think that is key in those messages, making sure that we have voices that all get heard and included and valued. So I think that may be where I'll stop.
May I just add a quick comment to that?
And then we're going to go to some questions.
Okay, perfect. My quick question is just, I think in addition to what you said, Mark, is that as I was listening to Sally and Mark, it made me realize that the call to action for me is there a formalized structure in place for that communication to happen?
Yeah.
A formalized structure where all stakeholders are engaged, involved meaningfully, and consulted. And my point from a PEI perspective is if there is not a formalized way to have that happen, there needs to be.
Yeah, so go back to your province and yeah, most definitely. So we have Slido. Did you want to explain? Deepa's going to explain the technology because we have some folks who are, I think those work or?
Sure. Hi, everyone. Thank you so much for that incredibly rich discussion. We have QR codes on your tables where you can access Slido, and everyone can put in their questions in Slido, and then Karen can start asking some of those.
Oh, there we go. Okay, so let's just start with some of the questions. So Anna from Quebec is asking, how can we improve partnerships between provinces for the federal framework's implementation? So what are some of the things that we can leverage to get those partnerships? Anybody? And maybe the federal, provincial, territorial group is, yeah.
That's it. Yeah, we have a working group that already exists, and we've had really great conversations. We need to, once the framework and strategy are released, we need to shift the terms of reference and the mandate for that working group to focus on implementation. And I think and then I know provinces and territories have signaled they want to bring more folks to that table from a provincial and territorial level. Not everyone has the same coordinating committee that PEI has. So Susie, you come and you bring that perspective and you go back, but other provinces don't operate the same way, and they have signaled they'd like to bring more folks to the table to be involved in that conversation. And so that's going to strengthen, I think, partnerships, but that's from a federal perspective, and Susie, you may have a different...
No, I think, to your point, Sally, that committee has been very, very valuable. And I think as that committee is expanded, then there's more representation from the various departments and across provinces. And the spin-off of that is that those connections are being made between provinces.
Yes.
And again, some of the provinces that are showing some great leadership in particular programming or services, then other provinces are reaching out to them and saying, how can we learn from you? That's happening organically. Yeah. So I think that that's only going to increase exponentially as this FPT, Federal Provincial Territorial Committee, expands more.
Okay.
Yeah.
And just one, I'll get to the next question. And I think when we were going back and we were talking about a lot about advisory committees, so my call to action, my sort of express would be ensure that your advisory committees have teeth to them. People are very tired of being on advisory committees that just provide advice and none of the advice gets taken. And so I just, that's sort of my call to action to your provinces and the territories and the federal infrastructure, that when we have these and advice is taken, there is a framework to show people how their advice is going to be taken and actioned, rather than just sort of advice and then you find out months later it goes the other way. So everybody can vote, and the question that has the highest one right now is, how do we account for the political differences among provinces when looking at a national policy for autism? Anybody want to comment on that one?
I can start by just saying, I think if I think of a policy for autism, the framework or a strategy, it's informed by evidence and through extensive engagement. So it's not a political document. It's a document that reflects the reality in terms of the gaps and the needs and the challenges facing autistic individuals in Canada. And so provinces and territories may have different ways of implementing things, but the essential needs and gaps that we're identifying are the same and grounded in evidence. And so you have to operate based on the evidence that you have. You would hope that evidence informs policy and program development.
Yeah, not on party lines.
Not
it's
on
across.
Party lines.
Yeah,
That's right.
and what was very exciting when the Autism Alliance was first pushing for the National Autism Strategy is there was this unanimous support across all parties about that this is needed. So I think that's, again, put it in the evidence. So what is the plan to meaningfully engage and partner with Indigenous people on the national, excellent question, on the National Autism Strategy? And as we were sitting, I was thinking this hasn't been addressed in this panel yet. So what is the plans for meaningful engagement that will lead to action?
Thanks, Karen. That is an excellent question, and we are proceeding and we are engaging with Indigenous communities. And so there has been the existing engagement that we did, and the Canadian Academy of Health Sciences did have Indigenous experts and panels that provided advice. And the report from CHS did say a lot more engagement needs to be done. And I'm looking at Lonnie, and who would agree, yes, absolutely, we've heard that. We're proceeding through, ESDC has something called engagement protocol agreements with 8 national Indigenous organizations. And it allows us to work with those 8 organizations for them to define the way in which they want to be engaged, and then provide advice to us on the priorities from their perspectives. And so there's always that respect for the distinctions-based approaches for First Nations, Inuit, and Métis people to make sure we proceed on a basis where we engage them in a way that works for them. So we're doing that right now. We've been doing that for more than 18 months. And we're also engaging in terms of the urban Indigenous perspective, the national, we have an Aboriginal Head Start Council. So they're the partners that we work with Indigenous children and families living off reserves. So we're engaging them as well to get their perspectives on what's needed. So the intention would be to develop Indigenous specific priorities for autism that will be reflected in the strategy. We have said the strategy will be evergreen, and people ask, what does that mean to have an evergreen strategy? Well, that means we're obviously going to have a strategy where we'll set an action plan for 5 years so we can measure progress, but at the same time, the strategy will evolve to incorporate the Indigenous priorities once we have received those from the Indigenous communities. So I hope that helps to answer the question. We take it really, it's very important. We take it very seriously, and we want to proceed on a basis that respects the way in which our Indigenous communities want to be engaged.
Thank you. The next one is, how can the framework provide better linkage between it's moving around. Linkage between childhood and adult services and supports, particularly in the current way ministry responsibilities are separated. In many provinces, and it is separated, and I'm from British Columbia, there's a Ministry of Children and Family, there's a Ministry of Social Development and Poverty Reduction that has adult services. So how can the framework better provide linkages across the life course? Any thoughts on how to?
I don't have advice on the framework piece, but I will say that, like in PEI, most adult services are delivered through our community partners and our NGOs and our community service providers. And so although those organizations may be funded by government, they are not necessarily specifically government-led programs. And so that's why that having more people around the table as part of the implementation phase is so important, because in PEI it's recognizing that it's our community organizations that are carrying that heavy load of supporting autistic islanders, and especially adult autistic islanders. Mm-hmm. So I would just say, I'm not necessarily answering the question, but I'm saying in our case, it's not even just within government departments, it's those community partners that need to be a part of.
And I think too, at that provincial, federal, territorial level too, is really pushing this idea that when you're meeting with the provinces and territories, that this is a life course issue. And so all of those representatives, I really love your structure of your autism coordinating committee, including deputy ministers. So those are the high level decision makers, yes, at the table. And I think, all provinces should push for something similar to that sort of infrastructure, so that we can ensure that moving forward. Another excellent question is, how do we move from a medical model to a social model of autism, specifically regarding the bioethical concerns around screening and so-called treatment? So just thinking about the National Autism Framework, and how does that national framework really support a social model of autism? Really sort of moving away from the medical model of being fixed and wanting, whereas we're looking towards more a social model of disability, where a person is not disabled because of what they cannot do, but because of the barriers put in front of them by society. So are there things in the National Autism Strategy that we can push for that remove those barriers, so that we are looking at more towards sort of acceptance and understanding of the neurodivergent differences?
Thanks, Karen, and thanks for the question. And we are moving definitely from that medical model to a social model. I think if I think of the framework and the strategy, I mean, it acknowledges that right up front. And definitely in terms of how we're going to move, there is that whole point around awareness, inclusion, acceptance, which is so important. And then there is a whole priority area just around screening, diagnosis and treatment, and it has to be sensitive to those types of issues, and where we're bringing in sort of the voices of people with lived experience, autistic individuals, families, caregivers, to bring that perspective about how we shift the approach around things like screening, diagnosis, and treatment. I think, there's just generally a lot of pressure from a health system perspective around how the health system needs to evolve. So bringing the research, the evidence, bringing the voices to the table, acknowledging up front some of these issues, which we do in the framework and the strategy, I think is going to help to shift things, recognizing that there's a huge diversity of views across the autism community, and it really depends who you're speaking with and what perspective they're speaking from. And so we have to be respectful of all those different perspectives in the way we approach the framework. So I hope that helps to answer. It's a complex question. It's a really good question, and one that we're really sensitive to.
Right. Mark?
Yeah, I was just going to add, it's always interesting to watch the trends that happen in how we talk about disability and ability, and how we elevate the person. And I think those changes are so critical, and that means getting voices from all kinds of different folks telling their stories. And I agree so much with that medical model. that needs to be not the focus. But on the other hand, we also see, and this is separating what being autistic is out from some of the things that make life difficult for that individual. We still need to look at how can we help reduce crushing anxiety. Those are things that I think when you think medical model, maybe the emphasis needs to be, where are we at with medication that makes a difference? Programs that help a person gain greater self-confidence and reduce that anxiety so that barrier is removed from being able to access things. So I think we need to get better about telling the story about who a person is versus the things that are either intrinsic or environmental barriers that can be helped in different ways, and to not be afraid to talk about that. And so I think to talk about both of those things really matters. And I also want to just comment back on the other question in thinking about the provinces and the changes politically. Honestly, I think it's interesting. I heard a talk one time by Arya Gitterman in Ontario, who said, you know, it would be nice if evidence was the thing that moved the bar, because that's what we'd all like to think. But the truth is, it has to be a combination of really hard advocacy that brings that evidence forward, and timing is good. And that all those pieces, and that people are in agreement about the most important things. And I think if we can think about that, we have to be creative about ways to get those messages out. And yes, I mean, I spoke earlier about information and evidence being right up there, and it's true, it needs to be there, and that's gonna be moving and changing all the time, and that we need to keep up with that. But you also need to bring people alongside who are gonna tell that story and make social media and media pay attention. And in Ontario, when parents got together and said, it's unacceptable what's happening, provinces changed their mind. And so we need to remember that those things always have to go in tandem, and sometimes you have to seize the day.
Yeah. And as you're thinking, I'm looking at, we only have a couple of minutes left, so I'm sort of looking at the two sort of top questions here, and sort of, I will just skip the one with 13 for just a sec, because we are on about authentic representation of diverse lived experience of autistics in Canada who really do have the pulse of the community. And I think that's part of our call to action as we go back to our provinces and territories, is what does that look like? Not just we're all going to push for a deputy ministers committee or what, but what is from the get-go, what is that lived experience voice, and how can we ensure that is part of that decision-making process? So I don't know if we're going to be answering that question specifically, but I really think it's part of our call to action. And then the last one that we'll go with, because I see my timer's going down and it might blow up. I don't know what's going to happen. So I shouldn't say that. That's bad. It's like you're in the airport and say the wrong words. So we know that that autism is internally under the health portfolio. How can we get connections to provinces where it could be under education, children, you know, a social services ministry? It's rarely under health. So I guess that, you know, how can we get to second level progress going forward? And so my question on that is that provincial, territorial, federal committee just health ministries, or are there other ministries, the lead ministries, involved in that? Like, how can, what ministries are involved?
There are ministries of health, but there are also social services. So we have gone to the deputy ministers and said, tell us who should be at this table. For some provinces, it's health. For some, it's social services. And so in the way the provincial ministries are set up, they're all slightly different. So it's a real range of different provincial ministries that are represented. But the folks who are at the table have said to us they want to expand it and bring more people to the table. So either, expand our committee to include other provincial ministries, or as we develop an action plan and there are specific items on the action plan, they want to bring the right people from the provincial ministries to discuss those specific items. So we're having real conversations. At our last meeting, which was only a few weeks ago, this is exactly what we were discussing. discussing, and lots of good suggestions from provinces and territories on how to expand representation at that committee. I don't know, Susie, you're one of our provinces on that committee. How, if there's anything else you would add?
No, I think you explained it really
Yeah.
well, Sally, and I'm excited to have those other jurisdictions and different ministries represented.
And even if the representation from that province does come from one ministry, if that province has that infrastructure where that person at the table representing a province has spoken with all that, knows what's going on in education, knows where the issues are in employment, knows where all those, they can bring that, help to bring that voice to that table as well. Well, we're in negative, nothing crazy happened, it just went minus.
It's never good.
That's all it is. So there are some other excellent questions here. So Deepa, how are we going, or do we have an opportunity to answer these questions sort of written down in some form after? Yeah. Yeah, so we'll keep these questions because I see there's some excellent ones around the 2S LGBTQ plus community and BIPOC adults, and so we want to be able to answer some of those. And so the Alliance will take a look, we'll chat with folks, and we'll see if we could provide some response. Yeah.